So hello everyone and welcome to another seminar hosted by the Centre of Research Excellence in Prevention of Falls Injury. So it is great to see you all here today. Many of you already know me, some of you don't. So my name is Marina Pinheiro and I'm a Senior Research Fellow at the Institute for Musculoskeletal Health, and I'll be the chair for this session today. So before we start, I'd like to acknowledge that I'm hosting this meeting from the lands of the Dwyer people, the traditional custodians of this land where I'm zooming from today. I pay my respects to the elders past, present, and emerging, and recognize and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters of New South Wales. I extend that respect to Aboriginal and Torres Strait Island peoples here today. So today we have a very interesting topic that we're going to cover. So we're going to discuss about translated research via the media. So we all know the importance of disseminating our research results, but most of us would like to learn more about how to engage with the media and how to magnify our message. So today we have two invited speakers with lots of experience in this space. So the session today will be divided into two. So in the first half of the session, we will have a talk by Julie Dwyer. And in the second half, we're going to have a Q&A session with Julia Teams. So just some housekeeping before we go ahead. So if you could please mute yourself, unless you are speaking, of course, during the questions at the end. And you're very welcome to submit your questions in the chat, but you can also raise your hand during the question time as well. So let's get started with our first speaker. So I'd like to introduce Julie Dwyer. So Julie's experience spans communications, media, and stakeholder management roles across the health, NPO, education, industrial service, and manufacturing service over 20 plus years. With a degree in engineering, Julie is highly experienced in research translation and distilling complex information into key methods and calls to action.
I'm going to see. You can't go for 1 minute, sweetie. I'm going to talk to Dad, okay?
So if you could please all mute yourselves, that would be great. Thank you very much. So in Julie's former role at the Australian Physiotherapy Association, Julie created opportunities for physio voice in mainstream media across many topical health areas, including commissioning research on tradies' health, which received national TV, radio, print, and online coverage. Julie is currently the Communications and Engagement Manager at Eastern Melbourne Primary Health Network. So Julie will give a 20-minute presentation, and that will be followed by some questions at the end. So let's welcome Julie Dwyer. So thank you so much, Julie, for agreeing to come and talk to us today. So I'll just stop sharing my screen so you can share yours now.
Okay, I'll just get back in. Thank you, Marina, for that introduction. Let me see where I am, and I'll get this underway. Okay. Can you see that? And is it in the right format, please?
So if you could put in the...
I haven't done the slideshow yet. Here we go. Yes?
Not yet.
Okay, so
it's not in the presenter view, not yet. So you can see.
Okay,
yeah.
Sorry, I knew I would stuff this up.
That's okay.
I will go back in and start again. I'm glad you're not asking me to talk about IT. Now, is that still the same?
That's perfect now, Julie.
Perfect.
Thank you.
Thank you. Okay, thank you, Marina, and thanks everyone for having me to present today. It's an area that I really love and enjoy doing. As Marina said, my experience has spanned a kind of a bit of a wavy line of different work roles and responsibilities, but in the last several years, I've really loved the work that I've done in getting media attention for some of the fantastic work, particularly through the Physio Association, where I worked for a number of years, and all the amazing things that were coming out of the research that so many people did. So this is going to just be a fairly short presentation, maybe 10 or 15 minutes. Feel free to ask questions either throughout or at the end, whatever's easiest. I have aimed this at a relatively simple audience, so I'm not sure how much media experience your researchers have, and I understand most of the researchers are working across exercise science and physio with some nursing and other health practitioners as well. Is that correct, Marina? It is, fantastic. All right, so it is fairly basic. Forgive me if you have much more detailed knowledge than this, but certainly I know Julia will be able to help you with some curly questions too, and I'll do my best as well. So getting started, here we go. I suppose the first thing that I would say before you even consider going out to approach media with some of your research outcomes is why, and I call it the why, what, and the so what. Why are you doing it? What do you want to achieve? And who cares about it? And you really need to have a really strong consideration of those things before you go out, because otherwise you're going to have a bit of a disjointed pitch with a lot of different information, which is obviously really important, but not necessarily conducive to a strong argument or a strong, compelling piece for a journalist to want to follow. So do ask yourself those questions and be clear about what you want to say, why it's important, and also consider the research that you're doing, the key piece, whether it's actual results or even an interesting question that you're looking to answer, because that can sometimes be enough of a hook to get media in, and then who would or should be interested in hearing about that, and you can then target a little bit better. Also, just in relation to the aim, have a think about what the overall aim is of what the research is you're doing and the message you want to convey. So things like, do you want to influence consumer behaviour? Do you want to influence health policy or change practices at an aged care facility, for example, in the way that they run exercise programs? Do you want to just provide an alternative choice or promote some sort of a new product that you've worked on in comparison or in conjunction with some of your other work? So really consider all of those things first before you get started. In terms of your medium, obviously we've got quite a few different mediums. They're all quite different. Each medium allows you to tell your story a little bit differently. So depending on where you might get interest from, consider again shaping it to the medium that you're being offered. So for example, if you're going to be putting stuff on social media or online, infographics can be really good. And I'll talk about that a little bit more later. And if you've got TV interview, often TV stations like to do pre-packaged stories to play on the evening news or late afternoon news. Think about the visuals that will go with that. You might have an exercise class or a practitioner working with a small group of patients, etc. Something that really shows or brings to life the information that you're telling. So when I have a think about some of the stuff, and I guess you can fit some of your research into this, sometimes you might need to think about it a little bit more carefully, but have a think about what the research is and whether it has wide appeal or benefits or even some unexpected results. And whenever you're doing that sort of work and thinking about putting your pitch together, keep it relatable. And I'll talk about that relatable idea throughout the next few minutes as well, because it's great to have fantastic research with awesome results that you guys know are groundbreaking in your field, but unless you can relate it to the broader community and why it's of interest, it's probably going to fall short. So it might be things like new technology or apps that support some of the work that you're doing. Okay, so don't discount the fact that technology supersedes or trumps exercise. You can try to work them in together if there's an angle there. Human connection and interest stories always sell really well, particularly if you've got a human or a case study that has a relatively high profile, and I'll talk about that a little bit more in a minute. But they're really good because they show the entire story of whether it's an improvement in function, whether it's a cognitive improvement, social connectedness, whatever it might be. Those sorts of things are really important to keep as part of your story. I'm not suggesting you ever discount the research and the data. Of course, that's the core reason why you're going to the media, but weave in some of that human connection as well. Those success stories and that overcoming adversity and sort of innovation in practice type stories really do tend to do well and get some wider interest. Talking about the idea of celebrity, for want of a bit of a term, or just someone with a profile, if you can match some of your research to someone who fits that demographic or that profile of the work you're doing, that can sometimes help too. Yesterday, I was talking to some colleagues from the other Victorian PHNs that I work with in the communications teams. And a few of them are very old, wizened journalists from a long time ago who have moved into this space. And when I asked them what they thought would be interesting in this type of scenario, they all mentioned the research and making sure the research relates to a story. But they also talked about using a face or a case study too. And one of them suggested, just as a completely by the by, off the wall idea, someone like Aisha Buttrose, for example. Now, she has a very high profile in the country. It doesn't have to be someone that high profile. She doesn't have to have participated in your research, but she might have a comment or a story to talk about her ageing experience or her difficulties in movement or confidence or whatever it might be, that you can then relate to your story and how your research is improving that for people of her age and demographic. It could be anyone else for that matter, but I'm just using Ida Buttrose because that was the person we were talking about yesterday. A little bit more on influencing journalists and appealing to them and what might make them interested and pique their contact to you is what we call the power of influence, and the 3 H's of heart, health, and hip pocket. Generally speaking, each of these will have a broad community interest, regardless of the type of research you're doing and who you're intending to try to target. So in terms of heart, that's that sort of human interest kind of story. Tell that person or the group story if you're working with a group of people. Who are they? Why did they undertake this program or do the trial? What was the kind of core reasons they did it? What's their life like now? And hopefully you're going to show a journey of something where they started off in a not great place. They moved through some difficulties and had some challenges and had some support, and then got to the end where they're doing really well. And you use your data to back that up as well. In terms of the health aspect, what are the compelling stats that have come out of your research that have more wide appeal? It might be cardiovascular improvement, improved cognition, whatever it might be. Use those stats. And of course, the hip pocket always has an interest. What's the argument for the exercise program or the research study that you've done, whether it's a cost saving to the individual or to the health sector as a whole? They're both equally appealing in my view, and use your data to show that. As an example, last year, the Physio Association commissioned the Nous Group, which is a consultancy, to look at the economic value of physiotherapy across a really broad range of health conditions, one of which was falls prevention. And so when we were using that in a range of different ways in our communications to media, to consumers, to members, etc., to other health practitioners, we talked about the fact that not only was there benefits to the individual through falls prevention programs, through improved wellbeing and so on, and better functioning, but there was also an X number of dollars health savings on hospitalisation reduction, on not having to do surgery, on not having to go through expensive and long-term rehab. So that the cost factor is also an important one to consider as well. We're talking a little bit more about shaping your message. And I'm talking here for media releases. Feel free, you don't have to, everything that you do doesn't have to be a media release. You can make a direct pitch to a journalist, and we'll talk about that. You might want to send an email, you might want to pick up the phone. There's lots of different ways of doing it. I've kind of focused on media releases here because that's, I think, kind of the area where you guys tend to feel most comfortable, but there's different ways of going about this. And number one, fairly intuitive. Be really clear in your messaging, short words, short sentences. You can, if you're choosing to target just 1 or 2 or 3 journalists, personalise your pitch to that individual. So know who they are. Generally speaking, you'll know that they write about health or science or innovation. So just make sure that you pitch it to their interest area, because that will make it more compelling to them. Just in terms of the short words and sentences, aim it in really plain English at around a mid-teens level. That's generally the kind of area. So 15, 16-year-old kind of cognitive level, I suppose, use those kind of words. If you've got access to media scheduling tools or in fact, even just a current email list, make use of those. Often universities do have those media monitoring platform software that they use. So get in contact with them and talk through how you can use those to your advantage. And be prepared not to hear back from anyone or hardly anyone. And if that happens, that's fine. But it's perfectly fine also to follow up, particularly if there's one or two that you know right about this area and you know that they have a bit of a history and an understanding of the area that you're talking about or researching. But don't do it more than once, because there is a real fine line between being proactive and being a nuisance. So I would suggest just do it once, probably wait about a week if it's not super time sensitive, and see how you go. And if you don't hear back, let it go and move on to something else. Timing is an interesting one, and I find that can often work really well to the advantage of the research work that we're trying to promote. So just have a think about if, and again, this would assume that the research you have doesn't have to get out as soon as it's ready. You can wait for a period or an event that makes sense. So if there's a current topical issue, feel free to leverage off that. It might be Falls Prevention Month, it might be Seniors Week, it might be Grandparents' Day, it might be a range of different things. If there's a way that you can leverage off those to produce and promote your research with a link to that, that's a really good idea. And again, a case study in that example would be fantastic. Talking to some colleagues yesterday, and we were having a bit of a brainstorm too, use a case study, either a high profile person or someone who's just got a really compelling story, and pitch it to magazines that work. Women's Weekly, for example, during Falls Prevention Month or something like that. And the other thing I would say is success doesn't mean it has to be on Channel 9 News or in the Sydney Morning Herald. Starting off and going to smaller publications can create a bit of a slow groundswell and can kind of have a bit of a ripple effect in awareness and engagement and further interest along the way. So don't discount the things like seniors publications, aged care home magazines that go very broadly nationally, particularly for the large aged care homes, health insurance publications as well. All of those, whilst individually relatively small, can have a really great effect ongoing. So talking about media releases, stick to a page, please. No one has time to read more than a page these days. Your research might be super detailed and have a heap in it, and that's absolutely great, but keep your media pitch to a page or less. Do use quotes, they're really important. They show that you've got a subject matter expertise who really knows what he or she is talking about. And the quotes you use should reinforce or add gravitas to the data or the research or the key assertion that you're making in your media release. Provide relevant links, normally at the end, but sometimes you might want to do a hyperlink in the body of the media release for supporting information, whether it's a link to the actual full research study or to a different research study or just to an article that's related. Feel free to add those. And as I've mentioned earlier, make friends with your media unit. So ask them for their advice, how they go about it, who they've had luck with before in terms of publications or journalists and things like that. And I've just added here, I've added SkyMax here and said, check out how other organisations do it. I just did a quick search last night. I'm assuming everyone is aware of SkyMax. Most of the universities subscribe to them. If not, it's essentially a science media platform. So for health, environment, science type information and media releases, it's a really great one-stop shop. I just took a screenshot of it last night. And in terms of the catchy heading, I loved the first one that they had, new insights into the formation of feces. Who would have thought? My interest was piqued straight away, so I wanted to know more about it. So keep that in mind, that it's something that will entice someone to go, oh, I want to check that out a bit more. SkyMax is a really good way to check out too, and it's constantly updated. So every week you'll see something really new to see how other organisations structure and release their news and their research. So please do use that as your tool, as a tool as well. Here, I've just done a really small example here, I pulled off something that I did at the Physio Association last year. This was around the time of the Aged Care Royal Commission into lockdowns due to COVID and the fact that aged care residents were not getting the exercise they needed and were falling behind quite badly. So we said new funding for aged care will save lives. Immediately that met, in our view, and this one did get some interest. Actually, one of the journalists from The Age followed this up a couple of times and spoke with Rick, actually, who's on the line here today. So we used a really simple, catchy heading. We had our key messages in 2 short sentences at the top, and then we added the detail. And the detail includes your data, it includes your quotes, it includes a case study if you've got it. and everything is very cohesive. Finish it off with a reiteration of what the key message is. It might be a call to action. The government needs to fund these Medicare items, or whatever it might be, and then add the opportunity for a comment and quote and references. Now, I've been really cheeky here and pulled something off the internet a while ago that I loved. I don't even know if this is real actually, but it doesn't matter. At the end of lockdown last year in Victoria, which was the 25th of October, it was basically we were able to get out of our homes and get back to living again. And it was just to get on the beers, which was a catchphrase that was very common and funny throughout the year last year. I wouldn't necessarily suggest you go something that small, but sometimes having a short piece to pitch and to entice interest is not a bad idea. So what happens if you get a bite from a journalist and they say, hey, tell me some more? So a couple of things, again, fairly basic, but it's good to reiterate. Make sure you say consistent, use consistent messaging. Repeat your core message that you want to get across in different ways. The evidence or the trial results or whatever it is that you're using should illustrate your point. So for example, your results might show a 74% decline in falls when XYZ program was done. Explain what that means in practical terms. That means that people are more confident getting out, they're more social, they have better mental health, whatever that might be. That's the kind of stuff that the numbers are really important, but the actual effect of those numbers is what people are really going to relate to. And also just know that being available is going to make you an attractive person for them to use as an expert again. And that's happened many times in the past too, where we've put someone forward who has been available, been really helpful, provided the information they wanted in a timely way, and they have been contacted a few times again on related topics for their advice or thoughts or opinion. So I just wanted to put in a little thing about flagging, which is essentially around pushing home your key message in your pitch and also in an interview. So this could be for radio, it could be for TV, it could be in a print article, it doesn't really matter. I'll put a couple of different examples in there. And again, what you use doesn't matter. It just matters that you leave the core message that you want to get across with the reader or the listener. And so that's just one way to do that. And it also signals to the journalist that this is the key point that he or she is making. So they're more likely to include that if it's done properly. A few things to keep in mind. First and foremost, about editorial ownership. Don't assume that you'll get advance copy to approve before an article or something is published. There's just no time for that these days. So assume that anything that you say could be used. It's really unlikely that everything you say will be used. There's just not enough room for all of that, especially if you're talking for 10 minutes to someone. And certainly in TV interviews, when we've had 10 or 15 minute filmed conversations, about 20 or 30 seconds gets to air. Assume that it could be used, and so just make sure that you're really clear and comfortable with what you're saying. Similarly, to reduce the risk of misinterpretation, keep your sentences short, make them simple to understand, simple terms, don't use jargon, acronyms, professional words, that sort of thing. If you think that the journalist doesn't quite get it, or if you think you haven't conveyed it well enough, please do take the time to say, let me explain that a bit more or in a bit more detail, because it's better to take that extra minute or two than to find that it's been misconstrued inadvertently when it comes to publication time. The other thing is stick to promoting your own work and the evidence behind your own work rather than undermining another practice or method. Sometimes you might be asked that, what do you think about, X method or X idea? Unless you have a really strong view and can back it up, steer clear of the undermining something else, stick to the evidence base that you know. Having said that, if you've got the evidence to say that, whatever technique or product is terrible, use it and use your evidence to say so. Oh, and the last one, just stay in your comfort zone. So get some media training if you think this is going to be something that you need to do a little bit of. There are lots of different ways to do it. Some can be quite expensive, but some can be quite cheap. Use your media unit if you've got one. They'll have some really good tips and pointers. You could ask them to set up a camera or do a kind of a pseudo radio interview or something just to help you get a bit of a feel for it. and start off small. So if you don't have experience in media, I wouldn't suggest you go on live TV to talk about a fantastic groundbreaking research trial, but doing something via email or on the phone is probably a little less daunting. Don't forget about social media. It is becoming more and more a big part of media engagement now. Journalists love Twitter. So the ones that you want to target, and you can target them by researching media publications and trying to match the work that you do with their interest areas and the topics they cover, because that definitely will have a higher chance of success rather than if you do a general sort of spray and pray across the entire health media. But if you are going to follow them on Twitter, find their handle, follow them, build a bit of rapport for a little while, like, comment, share some of the stuff you have, create a bit of establish a relationship essentially. Then choose your targets when you want to go out to pitch. I've put in half a dozen or so here that I just pulled out from our media monitoring that we use at work. I just typed in major metro health, science, medical journos, and then I filtered a little bit through to the ones that were more high profile. So most of these guys work for The Age, Sydney Morning Herald, a Network News, or the ABC. And use, as I mentioned earlier, infographics are really good to sometimes convey complex messages in simple ways. Canva is a really good tool. If some of you have access to Canva, it's quite cheap, easy to use. Use it as a bit of a hook. You don't need to pitch the entire story on an infographic. You might just pitch one really compelling piece of data or evidence or statement. And then once you get a little bit of interest, you can follow up with unfolding the story more completely. And just one last thing, what have I encouraged a lot of the physios to do last year, because obviously your core business is not to work in the media. You didn't do a journalism or a communications degree. You did a health-based science degree. You know your stuff, you're the expert. That's why you're being asked to comment. So a lot of people kind of put themselves in the same frame of reference with one of those, hard, cut to the throat political interviews that you often see on ABC. That's not what journalists want to do when they're looking at research translation. They generally want to understand the ramifications of the research, how it relates to the broader community, and get that across. And you're the best person to tell them that. So feel confident knowing that they're not trying to trick you or trip you up or anything like that. Again, keep it simple, relatable, expand to how this affects the community or this target audience or whoever it is. And just do some preparation and practice. It's perfectly okay to ask some questions in advance. We often did that in our previous work. Can you send through the key questions or the key areas you want to cover off, so that we could make sure our expert comment was going to be well prepared with stories, case studies, data, whatever it might be. And practice. Practice in front of the computer on your own. Get someone else to fire some questions on you and practice, but that always helps too. And just that's the end for me. Feel free to, as I said, to hit me up. I'm happy to take questions if anyone either is looking to create a pitch or has some interest and just wants to talk through some angles around how to manage it. I'm really happy to take an email from anyone and have a conversation with you. So that's it for me. I'll stop sharing my screen if I know how to. Here we go, stop sharing.
Excellent. Thank you so much, Julie. That was really informative and some really important tips there. So now we can open the floor for some questions. So does anyone would like to ask any questions to Julie?
I'll jump in.
Yeah,
oh,
sure.
Sorry, beat you, Rick. Thank you so much, Julie. That's really helpful. I just had a very small practical question. So you talked about sort of pitching directly to journalists. Like, how would you kind of physically do that? Like, would you email them, or would you do a sort of Twitter direct message, or what's your advice there?
Either. We've done both before. So when particularly if I've had worked with a journalist before on a particular topic, one last year was on return to sport after lockdown, and getting particularly teens and young adults back so that they're not going to be so injury prone. So I did a direct email. Hi, Kathy, we worked together on this story a little while ago. Here's another adjunct to it. Just wondering if you're interested. Added a few lines, let me know, I can sort something out. So I've done it via email, and you could do the same via Twitter as well. I probably wouldn't do it via Twitter direct unless you've started to create a little bit of rapport with them. but certainly once you have, that's a really easy way also.
Thanks, Julie. Rick would like to go next.
Yeah, hi, Julie. Thanks for a great talk. I've noticed I love watching a really catchy video case study, short and sweet. And I know a lot of the researchers in this group do some great work. What's the value in preparing a low production value of a video case study to create interests and potentially get some stories out of it? Is it worth it, or are we better to spend some money on it?
Good question. My initial gut is probably to say don't spend too much time and money on it, because they will use their own information and story if they've got interest in it. But it can be an interesting hook. If you are going to do it, I guess I would say keep it short. You know, even on social media now, watching videos for more than a minute feels like an hour these days. So keep it short. But understand, I suppose, have a really clear reason why you're going to use a piece of video rather than allow them to create their own story from the information you give them.
I was just going to add in, it is changing a little bit. Channel 7, Channel 9, Channel 10, they don't have as many resources as they used to. And even 2 or 3 years ago, they would never generally accept sort of grabs that we filmed ourselves. They do now, and for a story that we did recently, they took the grabs that we filmed with a professor, and they went on 7 and on 9. Case studies are harder. They do actually like to film and spend time in case studies, because that's generally how they format their stories, and that's probably even more, sounds weird, but probably more key than the professor who's being interviewed. So they probably want to spend time with the case study. But if you prepare something short, sweet, and nice, and it looks good, you might get a chance of getting a run on something like news.com.au, but it has to be good. There's no point in doing something half-assed and it looks a little bit rubbish, because it won't go anywhere.
Fantastic. You go, Rick. Sorry.
Just a quick, do you have any advice on where we would go to learn how to do that well?
There's various companies that do it, and some charge an absolute fortune. You can have huge variations in quotes provided for you. So just one video we had a quote for when I was at the Georgia Institute, they were going to charge $15,000 for it. I got it all done for 5, and that was involving graphics. But if you want to just get in, there's various cameramen out there who are cameraman editors, and I'm filming something next week, which I think all up's going to be about $1,000. And that's for filming and editing. So if you like, I can pass on some details for these people, because there are people out there who are pretty experienced and they're not charging much money.
Yeah, that would be wonderful, Julia. Thank you so much. We do have some more questions, but just before we move on to more questions, I just would like to introduce you, Julia, since we are already moving to the Q&A session. So now this is the Q&A session, and Julie Dwyer has agreed to stay for a while in this session as well. So we're going to be able to hear from both of them. So just a short introduction from Julia Teens. So she has a lot of experience in health communications and media. So she began her career in the UK in a local newspapers before moving up to national newspaper on Fleet Street. She moved to Sydney in 2001, and she joined 6 Minutes as a producer in 2004. So after 8 years traveling around the world, she moved back to the UK for a short stint and joined the Royal National Institute for the Blind's fundraising and comms team, working on high-profile events, including a gala with Her Majesty the Queen. Julia then worked as a senior producer with the 7 Network, where her work producing a feature-length documentary on the lineage siege won awards. She moved into health PR in 2016, joining the George Institute for Global Health, working across media, comms, government relations, events, and advocacy. She's now head of media and communications at Victor Chang Cardiac Research Institute. So thank you.
I wasn't expecting you to say all of that. It sounds like I've tooted my own horn. That's over a long time, by the way.
So thank you so much for joining us, Julia. And I guess we can continue with the questions. So Leanne, would you like to go next?
Thanks, Marina. Julie, you mentioned about, we could time things with particular events, like I think you said Grandparents' Day or something like that. What sort of lead-in time do you need to be contacting people in advance if you are wanting to time it in with an event?
I'd probably look at as much as you can without being too far in advance. So I would say around about a week is probably reasonable, possibly a little bit shorter, but probably more time the better. So to allow for scheduling in, news often have things scheduled in advance, etc. So just allows them to get that front of mind for their scheduling purposes.
Thanks.
Excellent. So just while we're waiting for additional questions to come, I do have a question for you, Julia. So let's say that we paid close attention to Julie's wonderful presentation and we did everything that she said in terms of understanding what sells and having a very clear media release. But these days, it seems to be quite tricky to get media attention with COVID dominating the media. So do you have any extra tips or advice on how we can get around that so we can get our message out? Because it sounds like COVID is going to stay around for a while. So any tips around that?
Look, there's no magic sort of bullet to this. It's really, really difficult. I think that some stories seem to just fly. Like I've got friends who work at different institutes and there's a story that you think would absolutely get coverage despite COVID because it's got all of those hooks and it just doesn't go. And there's other times where things just get a lot of pickup. So no great advice other than the fact that there is still, even if you look at all the bulletins, they're COVID heavy, but they have other stories and they're often compelling human stories. So what Julie has been saying about sort of case studies is so important at the moment. I don't think you've got a hope of getting a research up without a compelling case study, and that's for print and for TV. Radio wouldn't matter so much, but definitely for print and TV. Don't even think about approaching a journalist unless you've got that in place.
Fantastic. So we do have a comment from someone from the Brain Injury Australia. So for return on investment on time, energy, money, chase medium, how about capitalizing on riding the wave of publicity surrounding Carla Zapati, John Elliott, and Dan Andrews? Where is our go-to person on falls?
That's interesting about Dan Andrews. When he had his fall in March, the physio team did put together a couple of, not exactly cheeky, but very pointed stuff around supporting rehab and, back injury and so on. And Dan, contact an APA physio if you need some further advice and stuff like that. So we definitely did leverage off that. I suppose you just have to be careful in the context and the environment that you're in, that you're not making light or looking like it's an insulting kind of thing. But yeah, there are certainly ways you can do that for sure.
There's also an opportunity, and we had a couple of weeks ago where a story broke about there's an awful Channel 7 reporter who loves himself, and he got some reaction to the COVID vaccine, and he ended up showing himself in his hospital bed with his bare chest and his pecs out there, and he got a lot of coverage, and it was in a few papers, but it wasn't much about the fact that this was a really rare kind of extreme reaction. And we wanted to basically show, that it is rare, but it's not going to happen to most people. So we contacted each of the journalists directly, and within an hour got a direct quote from the head of Victor Chang talking directly to the condition. So if you've got something like Dan Andrews and you see that story is breaking, you can actually react very quickly, pull together a quote about what are the statistics of someone of his age group having a severe fall, what are the likelihood of recovery, rehab. And you'll find that if you contact that journalist directly who's writing the piece, they can add it in. We got coverage added into 3 newspapers in the space of that morning. So there's definitely opportunities to be had too.
Yeah, fantastic. That sounds like really good advice, Julia. So Jasmine has a question. Would you like to go ahead, Jasmine?
Thanks for the nice presentation. Just wondering about, and I think, Julie, you mentioned it a bit, the possibility is that now you don't get a chance to look at the final piece that's going to come out. There's no time. How to make sure that what you've said is not going to be so embellished that it's really going away from the evidence and you've got a nice small findings, but it just becomes blown out and not exactly what you wanted to convey.
Yeah, look, Julia will have something to say here too. There's certainly always that risk. I suppose the more experienced and respected journalist you're dealing with, the less likely that is to happen. But be aware, I suppose I often ask too, what's the angle of your story? If I'm not quite sure why they're asking for a comment or, some more information, I say, what's the angle of your story? And I'll often get it that way. I've never come across anyone who has kind of duped me and said it's this angle and then gone off completely on a tangent. So I suppose there's a bit of professional respect that you have to assume in there. But there's nothing to say that it won't happen. I just haven't experienced it myself in terms of being really prepared on what the angle is, what the questions are, and what value or what we can bring to that conversation.
Look, if you are worried at all, if there's anything that rings alarm bells, just put it in writing. Sometimes I think if it's something a bit tricky, I just say to the researcher, I wouldn't get on the phone with this one. Let's just put it in writing. Then we know that quote is the one that's going to end up in the paper. But generally the stuff that you're working in, I don't think anyone's going to ask you that killer question that's designed to kind of like spook you or, trick you. I think generally with falls prevention, you're probably going to be in safe hands with most journalists.
Fantastic. Thank you so much. So I just got a question from an early career researcher. So the person is asking if you have any tips for early career researchers to get attention from the media when it's usually more persuasive to have senior researchers delivering the message to the media.
I always thought that whoever does the bulk of the work in terms of the research paper should be the one that should do the bulk of the media. But if that person is absolutely terrible at media and is really nervous about it, that's when someone like, Anne or Kathy or, when I used to work with Chris would step in and help. So I think you basically divide, you work out in the sense of what are you comfortable with doing. But I would say in terms of the press release, that person who's done the work gets the bulk of the quotes and gets the first quote. And then you work out in terms of, when your media requests come in, what are you comfortable doing? If you're starting off, like Julie said, you don't want to be putting yourself up, even if they ask you to do the Today Show, because if you're rubbish, they're never going to ask you back. And it will put down the whole team as well. So think wisely. You could do a local radio station with a really small audience as a bit of a test run. And if you mess up, it's not going to look that bad because hardly anyone's heard you, but it will give you confidence. So yeah, just start slow, like Julie said, and build up, I think.
Thanks, Julia. We do have a question from Matt. Matt, do you want to ask that, or do you want me to read your question here?
Yeah, I'm happy to ask. I was just putting it in just in case I got cut off. But I was interested in the celebrity bit because there's been a bit of risk around that. And sometimes with some of the cancer messaging and other things, we've been a bit burnt in health when celebrities have less than ideal events happen in their lives and it gets popularised. But what sort of factors do you look at when you're thinking of a public interest story? Because one of the things I think we get lots of snapshots. But if you're wanting a message over a period of time to sort of change understanding or public health messaging around falls and injury in this case, what sort of things would you look at in terms of identifying a suitable person or group of people for that public interest story?
Look, I think celebrities are very, very difficult, especially with falls prevention. When I worked in London for the RNIB, Dame Judi Dench was losing her sight, but she didn't want to make a big deal out of it because she's getting old and she felt that it would affect her working life and her career. So for someone talking very publicly about falls prevention, if they're older, they probably may be a little bit worried about looking, old, and that could be a concern. Getting celebrities on board as well is really, really difficult. There's so many different sort of campaigns and causes out there. So I think very, very difficult. I'd just be looking out for if you see something in the paper about someone's having a fall, maybe a quiet approach to them to see whether they might look at supporting something involving a campaign that you're working on. Because if you've got someone, this is like, big name, but say if you've got one of the older sort of the 2GB radio hosts that has a massive platform and you wanted to achieve something in terms of changing public health policy, if he could start asking some questions or back something for you, then it would be a massive help, but a huge amount of work getting them on board and enticing them in the first place. I don't know, I would be a little bit wary about using celebrities just because, again, I got a little bit burnt in London as well. I think it's difficult.
Thanks, Julia. Julie, do you have any additional comments on that?
No, not really, just other than to say, I suppose there's a difference between using a celebrity as an ambassador and as someone who's just reinforcing a message because it's related to them. And they're sort of two different ways. So if that celebrity then decides to, you know, have a sex romp in a bathroom with someone and it all blows up, they're not your ambassador. They just happened to illustrate a story that you reinforce your research.
Fantastic. Thank you very much. So Julia, we have a question from Kathy. So she's asking, what is your definition of a researcher being rubbish? How can we tell if we were?
Well, one thing, that if they come and interview and send out a camera and you're only used for literally like 4 seconds, you know you're rubbish. If you're really good and you're in Channel 7 or Channel 9 and you get 2 quotes, like near the top of the story, the end of the story, you've nailed it. And in ABC, if you get a bit more, then fantastic. So what they're looking for is somebody basically that, as long as you know your messages, even if you're not confident, if you can literally repeat what has been said in that press release, because that's what they're going off. They're interested in your story because they've seen your press release, they've read your quote, and they're expecting you to basically say that. So if that journalist then turns up and then you say something a bit different or in a really convoluted form and use weird language, which is a little bit scientific, it's just going to be, they're not going to use you, and they're probably going to be looking at you thinking, this wasn't what I was sold. So yeah, if you approve quotes in a press release, say them, please. It happened a number of times when people just wouldn't say the quotes, and I was like, I don't know why we do our job sometimes if you don't listen to us researchers. So that's my advice to you. But yeah, rubbish is basically being too scientific, bumbling on like I am at this precise moment. Yeah, that's probably about it.
Thanks, Julia. So we have a couple of comments here in the chat from Anne Tidmer and from Charlotte mentioning that the stigma that we have attached to falls make it difficult to attract public figures as advocates, and that maybe having an angle of regular exercise to prevent falls or health aging is maybe a more positive angle to sell. And following up on this comment, I want to ask you about if you could comment on discrimination on the grounds of a person's age or ageism, and whether this could be a reason why it is more difficult to sell false prevention research to the media.
I don't know what you think, Julie, but I've noticed the ABC 7:30 in particular has been doing loads of stories featuring old people, often at the end of the bulletin. They've been doing really lovely stories about quite inspiring old people, mind you. And it just reminded me of the video that I think we did when we were at the George Institute with the old running guy who, I don't know if any of you have ever seen it, I might send it around afterwards, but there was a guy called Terry from down in Cronulla who was like an Aussie gold. He was like 90, still doing a bit of running, and just said it as an Australian man does. He was brilliant, and we ended up using him on TV. I think if you've got a really good, inspiring old person with a great story, then they're the kind of people that are going to kind of do well. And I think that in terms of older stuff as well, like Channel 7, Channel 9, their audiences that are a little bit older for news. And, they're at 6 p.m. where most of us used to be still in the office. I know we're not anymore, but we're probably still working at home at that point. But they've got older audiences, Channel 7, Channel 9. They like stories about back pain. I know they like stories about falls prevention. I don't think there is a difficulty in getting coverage, especially as the statistics for falls are so sort of compelling as well. So I'm not sure that there is ageism out there, but it's about providing compelling case studies.
I agree, and there are ways to promote, as the comments suggested, healthy aging. The positives. You don't have to concentrate on the falls, but on the fact that doing this reduces falls, and therefore we've got an active lifestyle, a really strong social life, etc., etc. And I agree. I think there's lots of aging stories on the news. It's just about making them a little bit more interesting and finding out what that is. We've all got mothers, grandparents, grandfathers, etc. So people are interested. We just have to make it really hit them about this could be me or my grandparent or my mother.
Fantastic. Thank you so much. So Kathy has just shared the link to the video that Julia mentioned. So yeah, we encourage you to have a look. It is a really interesting video. So just following up on this more positive message and trying to sell exercise and physical activity for healthy aging and prevention, one of the things that Julie mentioned in her presentation, that one of the things that sell is technology and new fancy treatments. So how do you make physical activity and exercise attractive to the media if we're not talking about any fancy new interventions? We're not talking about an app, just simple exercise.
Look, I think the difficulty is that even if you've got really, like Julie knows this, the health journalists out there are good. They know what good research is. They recognise when something's published in a decent publication, what that means. Their bosses don't. They don't care. They want something that rates. So if they see there's some fancy new technology thing that comes out, even if it doesn't work, if it someone says it does, and the PR company gives them a good case study, that will generally make it to air. That's for 7 and 9, by the way, and those kind of channels. But that's what you're up against. You're up against the newsrooms, not the journalists, who often go for the kind of the fancy stuff rather than stuff which is actually, probably actually going to help people. So you're probably never going to get around that. But I think what you do is just don't be disheartened by it. Continue on with basically pushing your research and working with those journalists who actually do get it.
Fantastic. Thank you, Julia. And Anne has just made a comment here that yoga-based exercise seems to be quite popular with the media. So yeah, Julie has to leave now. So thank you so much, Julie, for joining. We really appreciate.
My pleasure.
Bye.
So Julia, I do have another question for you. So we are organizing an event, and I might take this opportunity to actually share a slide here about the event. And we were wondering, so this is an event about staying active during COVID-19 restrictions. So this is targeted at older people. Let me just try and share my screen. Older people and people with disabilities. So in case like this, where we wanted to disseminate this event, so this is not like research findings that we wanted to disseminate, but it is an event that we wanted to attract some media. So do you have any suggestions on how we could go about? So which are, good places to try and disseminate? And I think Courtney is going to share the link to this event as well in the chat.
I think it's going to be really difficult just because of the timing. October the 11th is the date where restrictions lift in New South Wales. They're not going to be that far off in terms of New South Wales. The rest of the country doesn't have restrictions. So I think your timing probably couldn't be worse, unfortunately. We did a story when I worked at help with a union last year about putting out some COVID messaging, and that was just when we seemingly thought that nothing else was going to happen to Australia, and we dodged this kind of bullet. We got no coverage for it whatsoever. I think it would have been different if this had been basically organised maybe 2 or 3 weeks ago, even a month ago. Sorry to be such a downer. I would probably push it for Victoria because they're still going to be in lockdown, I think. Again, I think you could probably, could you find someone that is really struggling at the moment in lockdown, that is basically struggling from that sort of necessary, the lack of companionship, the lack of exercise, someone who's in, a lot of difficulty, but basically feels quite compelling. That would probably be my only thought. And yeah, maybe going to someone like The Age with that.
Sure. Thanks, Julia. So Kathy has a follow-up question.
Yes, thanks so much, Julia. We were disappointed when the restrictions were announced that day, but as easing that particular day before we had this planned. But I guess we were thinking there's still an ongoing message, because we're not going to suddenly return to all community exercise and sport. And I guess we kind of think it's a bit of an advocacy kind of opportunity, because we're feeling that people will actually need more support to get back into activities that they might have been doing before.
Could you focus on something
complex?
Could you focus on something in the sense of, is there any evidence or suggestion that the people being in lockdown for quite a while is basically means they are more at risk of falls now as they start to get back to exercise?
Yep, and there's evidence from the UK that fall rates have actually increased due to
I think that's your angle then. So it could be in the sense that you've got, it sounds like it's all this positive, but basically what we know from overseas experiences, this is probably one of the most dangerous points for people getting back into exercise, especially old people. Get some of that, the stats from the UK, it will help. But yeah, that actually might work as an angle. I think that's quite interesting.
Mm-hmm. And that seemed to be aligned to one of Matt's comment here in the chat. So can't you flick it to getting active again following lockdown? So maybe having a bit of a shift in the message. And a comment from Leanne, Andrew, as well, about using paid Facebook or organic Facebook groups to get the message across target populations. So yeah, good suggestions. Do you have any other questions or any other comments before we go? We have a couple of minutes to go. Is there any last questions or last comments?
I was just going to say to you all, don't be disheartened when you contact media and they ignore you. It happens all the time. They're horrible people. I used to be a journalist, but I actually used to respond to people most of the time, even if they sent me terrible pictures, because I just thought it was common courtesy. But common courtesy doesn't seem to exist anymore. Even when you contact people that you think you've had good relationships with, they just ignore you. You might text them, you might call them, they still ignore you. So just be prepared for the fact. No, it's nothing about your research. They're just probably really busy these days, and just unfortunately get used to it and just keep going, and hopefully someone will take your story.
Fantastic. Thank you so much, Julia. And just one comment from Richard here saying that during the COVID outbreaks, falls were quite common and a common reason for admission. So the intervention started to involve physio interventions despite the outbreaks, because falls seems to be a very big problem. With the restrictions and with the restrictions that we're having because of COVID-19. So I'm just looking here. I don't think I have any questions that I haven't asked. So I just would like to thank you all for coming to this session, and thank you again, Julia, for agreeing to come and talk to us. It's been a really helpful session. So thank you so much, and enjoy the rest of the day, everyone, and stay safe.